It is my pleasure to announce our first lightning speaker, Dr. Scott Frank and Drs. Amy Schoen. They are coming to us today from Case Western Reserve University School of Medicine, and I actually get to work with them pretty closely. They have been revolutionizing the health data sector with their tools and Health Data Matters. So in addition to seeking out more local health data resources, they also put together data not just on health information but on social determinants of health, and then also have roles in improving technology around the health data sector. So with that, I will turn it over to Dr. Scott Frank and Dr. Amy Schoen.
We really have, just go ahead and start clicking through. Some of you may have been here on Thursday when I gave a talk. We're talking about helping data learn to speak plainly, precisely, clearly, and to power. And now I've learned this morning how to help data learn to speak sexily. Go ahead. So Health Data Matters is all about empowering social change and health improvement through data availability, transparency, analysis, visualization, and data stories. Visualization is what we emphasized on Thursday and is about how to show data, how to speak data in a way that people can hear. So at Health Data Matters, we are believers in the value of local data, we're believers in the value of open data, we're believers in a robust health data ecosystem, which is interesting. This morning, Ed set up a metaphor of park rangers that can help people learn about what's in a national park. In a way, that's what we're trying to do, is help people navigate this national park of data. Go on. I think this is not the presentation that I planned for this morning. There was one labeled Flash for the quick one, and I think I'm going to move over here since I know which of the slides they intended.
Here, there's a clicker.
Just keep that on, sir.
Oh, where's the clicker? This one?
There you go.
Oh, did it move?
Yeah, we can kind of get it back here.
Let him know with the clicker.
Okay, it is moving now. All right, our emphasis is on what we refer to as hyperlocal databases, and looking at the entire variety of things that impact health, and then connecting those with the health outcomes that are so important to us all. This is a look at domestic violence as a health issue, and it shows where, this is by number of cases, but this is by the rate, and you'll see how different it is when you look by the number of cases and look at the rate. This allows us to examine some of the information by charts as well as by maps. And one of the things that I want to emphasize is the importance of taking a place-based approach. If you look at the relationship between domestic violence and household income on an individual level, the relationship isn't nearly so clear or robust as if you look at it by census tract. So it's not, here we're not showing the relationship between individual domestic violence and median household income or SNAP involvement, but we're looking at the rate of domestic violence in neighborhoods or census tracts that have higher rates of, or lower household income or higher SNAP participation. This is looking at domestic violence by education, and you can see the inverse relationship there. And I'm just demonstrating different kinds of graphs that can be created within our Health Data Matters site in order to examine these sorts of issues. We also have data about birth and death rates. We have information about redlining. Redlining is this historical process of essentially labeling neighborhoods in ways that created poverty within certain neighborhoods and wealth within other neighborhoods. And that was done in the 1930s, and the impact is still felt today on life expectancy. This is infant mortality by neighborhood, and the relationship again between infant mortality, low birth weight actually, and adequate prenatal care. This is an example. If you look at this on an individual basis, the relationship is very sparse between low birth weight and adequate prenatal care, surprisingly enough. But if you look at it by Census Tract, it becomes much more robust. So I do apologize. I prepared a separate presentation, but Taylor, thank you very much for putting it up, but this is the one from Thursday, not the one that I intended for this morning. And I do want to just go here. We have recently gotten access to data about behaviors in the city of Cleveland that help us take a look at issues we've never been able to look at. These are the unhealthy behaviors that we can now examine within the city of Cleveland. These are health outcome measures that we can now look at in the city of Cleveland, and preventive measures. And I've created some maps that we'll go through quickly here. This is obesity in Cleveland, and you can see that the obesity rate in Cleveland really replicates those redlined areas that were generated in the 1930s. If you look at no physical activity, you can see that it extends more into the west side in addition to that east side swath where the obesity lives. If you look at diabetes, again, it not surprisingly goes along the same patterns as the obesity and physical activity. But if you look at poor physical health in general, again, you begin to get into the west side, and if you looked closely enough at the redlining maps, parts of the west side were redlined as well, and those are the same parts where we see the poor physical health. On the other hand, if we look at binge drinking, it's an entirely different pattern. Where's the binge drinking happening? Where we sit right now, in downtown, and on the far west side. The east side doesn't have that binge drinking.
What time is it?
All day.
I will point out that this is where Case Western Reserve University sits. So, I think this is the value of using place as a guide to making data sexy. People care about where they live, and this can become so hyperlocal that one of the websites created at the hackathon, it started at Hackathon 2 years ago and created since then, called Street Health, allows you to type in any address, initially in Cuyahoga County, but I think he's got it set up for the nation now, and that address then has a neighborhood profile associated with it.
It's healthstead.org. Healthstead.org.
Healthstead. And that gives a neighborhood profile with 10 to 13 different characteristics of that neighborhood associated with that address. So I was going to just share a few maps from my own city. I am the Director of Health for the city of Shaker Heights. This is how the median household income looks in the city of Shaker Heights, the racial makeup of the city, the presence of a high school degree or not, childhood poverty. So there is a distinct social geography in Shaker, just as there is in the city of Cleveland. And you can see life expectancy tends to map with the areas that have the other problems, age-adjusted heart disease death rate, cancer death rates in the same sort of way. I'm aware that we only have a little bit of time this morning, so I'm going to pass it over to Amy to wrap things up.
Thank you. And I just wanted to mention, first of all, the two websites that we have on these open platforms are on these little mini mouse pads, healthdatamatters.org and hdm.livestories.com, so you can get some here or at that table over there. And finally, we are really hoping to catalyze entrepreneurship and innovation from these data. We do that through the Cleveland Medical Hackathon and the upcoming Medical Capital Innovation Competition, but lots and lots of other ways. So using big data from community health isn't something that's really been done very much, but I think that is how we're going to get improvement in population health. Thank you.